want to talk about three things. First, we'll talk about the basic insertion technique, and then I'll talk about where I specifically find the expand ring helpful, and then finally just a few little tips or pearls. So the injection technique is to install the initial foot at the distal iris, and when I first started with the ring, the key thing to learn was not like our intraocular lens injecting from the incision site, but actually inserting the injector almost to the center of the pupil to more carefully and precisely place the foot plate. Then the next step is just placing the lateral feet, and I've found that sometimes it comes out such that both feet will seat simultaneously and effortlessly. If not, usually one will want to go in the right place, and so I'll just tilt my wrist to get the first one in and then tilt the other way to get the second one in. And then the next step is simply, as you can see there, to drop the trailing foot right on the iris surface, and a great instrument, the Williamson manipulator, or very similar to a Kugelin hook, but a little bit smaller and a little bit more polished, to just drop the final foot behind the iris, and then you can see it centers beautifully. That's one of the nicest things about the ring, is that it centers so perfectly. And we obviously want the phaco and the IA tip to go directly through over the proximal foot plate. If it's not that way, the Williamson ring will very easily allow you to rotate a few degrees to get it just right. And then when it comes time to remove the ring, what we do is simply reverse the process. Just take the proximal foot plate, lay it on the surface of the iris, the ring on the surface of the iris, and bring it back through the wound.